The inaugural function of the Meghalaya Medical Services Association's 22nd Scientific Conference cum General Body Meeting was held on 27th May 2022 at the State Convention Centre in Shillong. The theme for this year's two-day conference is Medical Professionals, Health and Wellness. The chief guest on the occasion was Speaker of the Meghalaya Legislative Assembly, Medba Lyngdoh, while the Minister of Health and Family Welfare Government of Meghalaya, James P.K. Sangma, was the guest of honour in the presence of the Commissioner and Secretary Health Department, M.N. Nampui, the Director of Health Services, M.I. Government of Meghalaya, Dr. Amanwar, the Director of Health Services Research, Dr. Hannah C. Lindem, the Director of Health Services, MCH and FW, Dr. L. Chalam, the President of the Meghalaya Medical Services Association, Dr. Y.A. Phira, the General Secretary of the Association, Dr. Macmillan Surong, members of the association, medical practitioners, besides others. During the program, a souvenir of the MMSA was also released by Chief Guest Medba Lyngdoh. Addressing the gathering, James P.K. Sangma spoke on the state mental health policy, of which the government is working towards implementing the same in Meghalaya. On the infant mortality rate and maternal mortality rate, the Meghalaya Health Minister said that it is important to bring down the rates to zero, even while this will be a challenge to the medical profession.
But more so, this came into a sharp highlight during the COVID-19 pandemic time. And this really goes to show that despite all those hardships, the challenges, the way that the doctors and other medical professionals, the nurses, our paramedics, frontliners, the way they came forward and the kind of service that they offered at that point of time, it goes to show that being a medical doctor, it is not a profession, it is a calling. And this is a calling which requires a lot of empathy, a lot of compassion, and I'm so happy to see that all those qualities during the COVID-19 pandemic time really came out, and we witnessed the kind of service that you offered.
In his address, the Speaker of the Meghalaya Legislative Assembly, Medba Lyngdoh, while terming health as a goal and wellness as a means to achieving the goal, informed that as per statistics, Meghalaya has approximately 600 doctors who have to cater to patients in the ratio of about 1:5,500. He therefore said that the Meghalaya Medical Services Association should aim at handling this shortage of doctors in the state.
What is the purpose of considering this association? I am very sure, with no doubt at all, that the person or persons who initiated to have this association is to have a better team altogether. I'm sure that at a point of time, those who initiated realized that as an individual, he cannot or they cannot deliver what they have in mind. Therefore, the association at that point of time has been constituted with the objective to deliver that together as one. We all need it, but most importantly are the medical professionals. We all know that health refers refers to a state where the physical body is free from disease. And wellness refers to an overall balance of a person's physical, social, spiritual, emotional, intellectual, environmental, and occupational well-being. And if we have both, we can say that when we have life, so we can have the world.